Hello, my name is Diana LaFoy, Administrator of Life and Health Compliance at the New Hampshire Insurance Department. We are pleased to provide guidance to assist carriers that wish to file individual and small group medical and standalone dental plans, as well as general guidance that applies to large group medical plans. Representatives from the Life and Health Compliance Division will present the filing process for the 2020 plan year. On Thursday, April 18th, the department will host an interactive webinar open house from 2 p.m. to 3 p.m. Eastern Time. We hope that you will take this opportunity to participate. At this time, I'd like to introduce David Scheckman, one of the compliance examiners who will start off this presentation. David?
Thank you, Diana. Again, hi, I'm David Scheckman. I'm one of the LAH examiners here at the department. I'm here to discuss the QHP process. We will start off with slide number 4, which shows key dates, and slide 4 is mostly in regards to the on-exchange binders. On June 19th, the initial transfer of the binders will be going into CMS, and on August 21st, the final submission will be sent over to CMS in regards to the binders. Please note that the open enrollment period is from November 1st through December 15th. Other key dates on slide number 5 include the initial forms and rates and binders for issuers who have on-exchange plans. Please note that you should also submit your on-exchange forms and rates along with your off-exchange form and rates as well. Again, this is due on May 12th. The last date to make the initial rate changes, filers who are just doing the off-exchange plans only, they're supposed to be submitting the binders, forms, and rates on June 29th. The final rates are due on July 18th. The deadline for the initial QHP application rate table templates is July 24th. CMS will be sending out the first correction notice on August 9th. The final deadline for issuers to change the QHP applications or withdraw the plans is August 21st, which coincides with the final transfer of the binders. CMS will post the QHP agreements and plan lists on September 16th, along with they're going to be sending out the final correction notices as well. On the data correction window, this year will be from September 19th through September 20th. In regards to the signed agreements, the window for issuers to send these signed agreements is from September 16th through September 24th. CMS will be sending out the certificate notices out on October 3rd and October 4th. In regards to the hospital network, the insurance department will be posting the update on October 15th, with the final posting of the hospital networks sometime in early December. We go now to the next slide. This is the QHP Guidance and Tools. CMS does offer some guidance in regards to with the SURF industry user manual, and they also have the new QHP application website. The insurance department also has some guidance and tools as well, which can be found on our website. These include the 2020 QHP certification issuer issuer bulletin, and we also have the QHP filing checklist, along with the master list for the SURF forms and binders. Go to the next slide, on slide 7. We have carrier assignments. As in the past, we've always had an examiner here assigned to specific companies that are submitting the forms, binders, and rates. This year, Ingrid Marsh will be handling Harvard Pilgrim along with United Healthcare. Gail Matson will be handling Delta Dental, MetLife Dental, Anthem standalone dental plans, and she will also be handling Ambetter as well. And myself, Dave Scheckman, will be handling the Anthem / Matthew Thorne binders along with Tufts. Go to the next slide. We have information regarding the QHP Weekly Calls. As in the past, we schedule a day and a time for the carriers to call each week with questions or issues or concerns, and the insurance department we make ourselves available to respond to these questions. New Hampshire Insurance Department will announce a standing time when they will be available. Calls will begin the week of April 22nd. Issuers must schedule the time block. In order to do so, you can contact Deb LaCrosse to schedule this. And we also request that the issuers submit their questions in writing 24 hours in advance. This will enable the department to be prepared for the weekly call and also get the necessary people involved if necessary. The department will also post significant updates that arise from the questions and responses that pertain to all issuers. However, please note that the department will not distribute any information pertaining to carrier-specific information, product design, rates, or other proprietary information. I will now hand this over to Ingrid Marsh, who will discuss about the federal review tools.
Thank you, David. This is Ingrid Marsh. I'm a compliance examiner here at the department. And as David mentioned, we will now talk about federal review tools. Each year, we all anxiously await CMS's release of the review tools and required documentation and instructions along with the other training materials in order to ensure accurate completion of the QHP application. To the left, you'll see at the bottom left of the screen, you'll see a listing of the tools that are required this year to complete your application to the department. A complete list of the tools is also found on the NHID website within the binder master checklist. At this time, we're currently awaiting release of the CMS 2020 application review tools. As soon as we hear more, we will let you know about that. You can also find a listing of the tools required at the CMS's Qualified Health Plan website, and an example is shown below the screen so you know you're in the right place. On to the issuer evaluation of QHP application. Review tools required. CMS QHP tools, the issuers must complete attestations that the CMS QHP tools have been run and that all errors resolved prior to your submission. You'll see to the right, you'll see an example of the attestation form that's required. This can be found on our website under the Plan Year 2020 information that's on the bottom right of the screen. If you run your tool and you receive unmet status, you will be required to add an additional column on the right showing a justification for each of the tool's results if you feel you're still compliant in that area. Both the attestation form and the Excel spreadsheet must be uploaded to the supporting documentation tab of the binder in SURF. This year, one staff member here at the department will be responsible for running the tools for 2020. So we're urging you to complete the templates using the utmost care and accuracy so that we can avoid the back and forth objection process. This slide is self-explanatory, but to summarize, the medical and dental qualified health plans will be subject to different standards for marketplace certification. The medical QHP requires a total of 10 tools to be run, and you'll see that list there, as opposed to the qualified SADP plans, which only require 5. You'll want to note, though, that both the dental and the medical plans require an ECP provider tool. However, those tools are distinctly different. The SADP tool should be clearly labeled. If you have any questions about that, please contact us. Next slide. Continuing with the issuer evaluation of QHP application. Your data on the plan and benefits template must be accurate and must match the policy forms. Anytime we write to you to make a change to either the plan and benefits template or the policy forms, you'll be required to make the same changes to the other document. If we write to you on the form filing asking you to change information on the schedule or an SBC, you must be mindful that the change must also be made to the other side, or the binder side, which is the plan and benefits template. Again, if you receive an objection, whatever revision you make to the plan side must be made to the plan and benefits template, and vice versa. Below is an example to remember, to keep in mind when you're making these changes. Next page. Now I'll turn over to Gail Matson, who will talk about cost sharing.
Thank you, Ingrid. This is Gail Matson. We're looking at slide 13, cost sharing. Cost sharing has risen for 2020. We are awaiting final CMS guidance for that number, and we are also waiting on IRS guidance on the HSA limits forthcoming in May. Next slide, please. This is the cost sharing for out-of-network services. Issuers must count cost sharing paid for an EHB provided by an out-of-network ancillary provider at an in-network facility towards the in-network maximum out-of-pocket, unless the issuer provides written notice by the longer of the 2 bullets listed below. Please note that the insurers must provide a statement to the department outlining how they are complying with this requirement. For 2020, the annual notice of consumer rights and access to out-of-network services is listed below the link and must be filed into the supporting docs in the QHP submission for all QHPs and SADP. Next slide, please. Balanced billing protections. The department's tasked with the enforcement of the RSA noted above.
Thank you, Mr. Chair.
Providers of anesthesiology, radiology, emergency medicine, or pathology services are prohibited from billing consumers covered by managed care plans for fees or amounts other than copayments, deductibles, or coinsurance if that service is provided in a hospital or ambulatory surgical center that is in the patient's health insurance plan provider network. That prohibition applies whether or not the healthcare provider is contracted with the patient's insurance carrier. Please note that in instances of a carrier and provider not able to resolve the issue amongst themselves, that the department might be called in to determine what is a commercially reasonable fee. The issuers and providers are encouraged to make their best effort to resolve the dispute prior to seeking the department's assistance. Next slide, please. Prescription drugs. Issuers must provide notice of mid-year formulary changes to enrollees, CMS, and the department. Below, you'll note that there are federal requirements as well as state requirements. There are certain areas of overlap between the federal and state notice requirements, and each notice requirement has specific requirements relative to contents and recipients. We're asking that issuers familiarize themselves with the details and make sure that they comply with the most stringent requirements applicable to the given situation. Next slide, please. Prescription drugs. Health plan must have a process to allow the enrollee to request and gain access to clinically appropriate drugs not otherwise covered by the health plan. You'll see the internal and external and expedited reviews on your left side of the screen. In the event that an exception request is granted, the accepted drugs are treated as an EHB, including counting any cost sharing towards the plan's annual limitation on cost sharing. The department has moved to a uniform prior authorization form. Issuers are not allowed to edit or require more information than is included in that form, but they may have a version that the carrier contact information is pre-filled on the website. As in past years, all carriers must accept and use the New Hampshire Standard Prior Authorization RX form, and you'll see the link noted below. Next slide, please. Prescription drugs, cost sharing for brand names, for brand drugs. When a generic alternative to a brand prescription drug becomes newly available, the issuer may make a mid-year change to the formulary in order to add the generic drug to the formulary and to remove or change the tier of the brand drug as outlined above. However, please note that for consumers for whom the brand drug is medically necessary, the cost sharing for the brand drug must be no less favorable to the consumer mid-year than it was at the beginning of the policy year, regardless of any tier change made generally. Next slide, please. Continuing with prescription drugs, the following reviews will evaluate prescription drug coverage for compliance with applicable law. See the clinical guideline-based review of prescription drug coverage, and the list down the side on the left of applicable medical conditions. It also evaluates whether certain first-line therapies are available without step therapy or prior authorization. New for 2020, issuers must complete the formulary file with initial plan filings. The 2020 formulary Excel file must include the National Drug Code, the NDC, without hyphens. The information collected will help NHID in the development of future policy. The form should be filed in SURF under the Supporting Docs tab with a complete and final list of the drugs included in the plan for plan year 2020, uploaded prior to the close of the certification period. Next slide, please. The formulary category and class count. The plans must cover the greater of one drug in every USP category and class, or the same number of drugs in each category and class as the EHP benchmark plan. Naloxone is the only drug in the anti-addiction substance abuse treatment agents class. The department joins CMS in encouraging issuers to cover all drugs used for medication-assisted treatment, or MAT. Coverage must comply with EHB non-discrimination requirements and federal mental health parity requirements. Formulary outlier review. CMS will not conduct active certification reviews for formulary outliers and will allow the state to process that instead. Next slide, please. Standalone dental. All standalone dental plan issuers are bound by the same timeline as QHP issuers. The SADPs shall be filed using the SURF system, and the standalone dental plans as offerers of accepted benefits are not subject to many of the requirements that are applicable to all QHP issuers. Please note that if all issuers are reminded that if no issuer offers a standalone pediatric plan for plan year 2020, then all issuers must embed the benefit. The department will make all issuers aware if a filing revision is required soon after the initial intake procedure is completed, so that issuers may revise and embed pediatric dental if necessary. Next slide, please. Issuers must send all consumer notices and correspondence related to auto-enrollment to the department for approval prior to dissemination. Notices can be sent to the attention of Diana Lavoie and will be reviewed in a timely manner, but we're encouraging issuers to allow for the appropriate time needed to ensure that they meet any notice requirement deadlines. You will see the department guidance below from 2018 relating to auto enrollments and that link. Next slide. Next, we'll go back to David at part 2 of network adequacy.
Thank you, Gail. In regards to network adequacy, issuers are responsible for complying with NHCAR Part INS 2701. In addition to the federal ECP templates, carriers this year will need to submit 2 templates pertaining to network adequacy: the New Hampshire Hospital template and the NHID network adequacy template. The only thing new about these templates are the names. These 2 templates have been used in the past. The New Hampshire Hospital template used to be the network summary template, and the NHID network adequacy template used to be the provider file template. Both of these templates should be submitted under the supporting documentation tab in the binders. Slide 24 shows the New Hampshire Hospital template. Here, the carriers must indicate which of the 26 acute care hospitals in New Hampshire that are in their proposed network. When listing the hospitals, carriers must indicate if the network contract with the hospital includes full scope of services. Going to the next slide, slide number 25, this shows the NHID network adequacy template. Here, the carriers must include complete and accurate information as it pertains to the issuer name, network ID, the network name, the national provider identifier, the provider name, and the provider's street address, city, state, and zip code. Each network the carrier has should be submitted separately by using a different tab on the bottom of the template. Going to the next slide, there's some friendly reminders as it pertains to the network adequacy templates. Provider information submitted must be representative of signed contracts in place, and all data submitted must be accurate and current as of the filing date. Issuers must provide updates if changes are made to the issuer network after submission. These include, if it impacts compliance with network adequacy standards, or if it results in the loss of a major inpatient or outpatient facility or large provider group. Also, such changes must be reported to the department in writing immediately, and the updates in all applicable state and federal templates via SURF. I will now hand this over to Ingrid Marsh, who will discuss about advertising.
Thank you, David. Next, we'll talk a little bit more about your SURF filing, and we'll start with the advertising piece. Advertising materials for all your plans that are submitted for certification must be filed with the department in SURF prior to use. Be careful that you do not, when creating your advertising materials, that you do not create the effect of discouraging the enrollment of individuals with significant health needs. Your advertising must also comply with INS 2600, and in particular INS 2601, which is the Accident and Health Advertising Rules section. Advertising materials must also include web pages and social media posts. In the past, we've had some pushback on that, but looking at the definition of advertising, it does indeed include those items. Also be familiar in 2601 with the type of ads that you're filing, whether they be invitations to inquire, invitations to contract, or lead generating devices, and indicate that in your cover letter. Remember, the requested filing mode should be for informational and not for review and approval. Next slide. Continuing on with advertising. Carriers must submit an attestation in the supporting documentation tab of the binder in SURF stating that all your ad materials are in compliance with applicable state and federal regulation. The ad attestation that we require is found on the NHID website under the Plan Year 2020 filing materials. Be advised that advertisements are subject to a market conduct review if issues arise. If we do see a trend that in your ad filings that indicate misleading or inaccurate ad pieces, this may trigger a market conduct review. If we discover problems with your filing, as always, we will, with the information only filing, we may ask you to change the filing status to review and approval and complete a full review of the ad materials. Next slide. Moving on to the summary of benefits and coverage. Summaries of benefits and coverage, also known as SBCs, must include a web address that links directly to a copy of the individual policy or group certificate of coverage. All URL links included on the SBC must link directly to the referenced information, such as your specific formulary or your schedule for that SBC benefit package. QHP insurers are required to make SBCs available to accurately reflect each cost-sharing plan variation and must include a separate URL on your company website linking the SBC created for each plan variation that is part of the QHP data submission. SBCs must disclose whether or not the QHP pays for abortions or for which federal funding is not available. The CMS SBC instructions and templates can be found in links on our Plan Year 20 bulletin and also in the Filing Rules tab in SURF. Further details and requirements for SBCs and schedules can also be found on the NHID filing checklist. Okay. Filing your QHP in SURF. QHP filings can be submitted through the NAIC system of SURF, as many of you know. For any new company staff that might be out there, the process from SURF to plan visibility on the marketplace is diagrammed below. You will submit, both your binder and your form rate filings through the online portal known as SURF, and which, once we complete our review in August, will be transferred to CMS for their review. Once they've completed their review process, your plans will appear on the health insurance marketplace. Next, please. Continuing with the SURF filing. QHP filings to be submitted through SURF. The SURF components include both your form rate filing and your binders. The online portal also includes a SURF Plan Management Industry Manual, which can be found at the top right corner of your SURF screen. Keep in mind that New Hampshire has retaliatory fee requirements, meaning that issuers of state of domicile determines whether the issuer submits a filing fee or not. Next slide. Again, instructions to create a filing are found on the SURF Industry User Manual that's located under the Help link in the top right-hand corner of SURF. Filings must be submitted as a form rate filing. The on-exchange forms and binders, you'll see a calendar below. On-exchange forms and binders are due on May 12th, 2019. With the initial rate filing due also on May 12th. I'll make a note here that your off-exchange form rate filing will be, if it's included in your on-off binder, must be submitted at this time. The off-exchange only binders will be due on June 29th. This will enable carriers to focus on their on-exchange form rate filings and binders that are due May 12th. And final rates for all binders must be submitted no later than July 19th. Next slide. Next, we'll talk specifically about your form rate filing. Below are the forms that are required to be filed, depending on whether it's group or an individual filing. We also ask that your cover letter include an indicator of whether your filing is HMO or PPO. Be sure that the license that you submit to the company contacts tab matches the filing. Sometimes we've seen a PPO license submitted on an HMO filing and vice versa. You'll also want to indicate on your cover letter whether your form rate filing is on or off exchange, filed for both on and off, or off exchange only. If you're using previously approved forms, you'll want to note that also in your cover letter, and also include the previously approved form's CERF tracking number on the supporting doc tab, along with a copy of that form. An example could be your ID card or your off-exchange application. We've seen carriers wanting to use previously approved ones in the past. That would be the way to indicate that on your filing. Next slide. Components of a form rate filing. Again, this slide addresses the supporting documentation. Below is a list that I won't belabor. You can read there the requirements for the form rate filing. I will point out that the checklist must be completed and signed by a company officer, and we ask that you check all the boxes on the form, with the goal being compliance. If you don't feel you're required to comply with a certain item and you check no, please explain in the box below why you don't feel you're need to be compliant with that item. Patient Bill of Rights must be verbatim. You can't make any amendments to that, and you'll want to refer to our Patient Bill of Rights law for the exact language that's required. The summary plan description of continuation and coverage rights. If this item has been previously approved by us, you will want to note the CERF tracking number and link the previously approved document here. If it hasn't been, you'll need to submit it to the Form Schedule tab. The rate filing materials are the last bullets in the list. You'll want to submit all those items as well. If you have any questions about the materials that required, you'll want to contact our LEH actuary, David Skye. Next slide. Moving on to the binder requirements. Binders contain the specific QHP content and hyperlinks from form filings. On your Associate Schedule Items tab, it's important to link all the CERF tracking number and the filing documents associated with a particular plan on that tab. The instructions for completing your binders are located in CERF under the Help link under the Plan Management tab. The final binder transfer date by NHID to CMS will be August 21st, 2019. Next slide. Continuing with binder filing requirements, moving on to the Associate Schedule Items tab. The issuer must link documents from the form rate filing to that tab, as mentioned before, noting the CERF tracking number. Forms and rates assigned to specific plans with the binder. Instructions for associating forms, rates, and supporting documentation can be found again in the Plan Management link under the Help link at the top right of the CERF screen. Next slide. Moving on to the templates. That's self-explanatory. Those templates have not changed from prior years. However, the version of the template may have changed, so you'll want to check with CMS for the correct version. Those are, again, the same as in previous years. Slide. Moving on to the binder supporting documentation. The list is there. I won't read that list here. However, I will note for the Plan ID crosswalk, you must, whether you're crosswalking the same plan from year to year or a different plan, it's important that you reflect that on the Plan ID crosswalk. and we strongly recommend that you follow CMS's instructions for completing that form. Also, as David mentioned earlier, we've made a change to the network adequacy templates, and their new names are reflected here, the New Hampshire Hospital template and the NHID network adequacy template. Under your state insurance license, those do not get issued until June or July, so you will just need to submit your current license with the filing in May. You can expect an objection from us to remind you that when you receive your renewal license in midsummer, that you attach it to the binder. Also, all TPA licenses are required to be submitted per the same instructions above. In addition, your formulary file must be submitted both in Excel and PDF formats, including the NDC codes. Next slide. Some helpful filing tips. In order to receive recommendation for certification, issuers must provide proof that they have applied for or renewed their license. The state license must be provided for the correct company. HMO product must have an HMO license, etc. All TPA licenses must be submitted to the binder portion of the filing. The CMS annually requires a submission of a certificate of good standing. This is a form that must be requested by you. It's not automatically renewed. And the information for contacting the department, on who to contact here at the department to obtain your certificate of good standing is shown below. Again, updated New Hampshire licenses and certificates of good standing must be attached to the binder. Next screen. More helpful filing tips. Bookmarking. That is one of the things that we most commonly write on. All forms containing 3,000 or more words or printed on 3 or more pages must first of all contain a table of contents or an index, and the form must be bookmarked to the table of contents. So keep that in mind. Also, the NHID filing checklists are required to be submitted on the form filing, and the list of those required checklists are shown below. Updated checklists for 2020 are in the process of being completed and will be posted on our website. Next slide. Continuing with helpful filing tips. You must select the applicable TOI for your filing. If your filing is an HMO, you'll want to make sure that you utilize the correct TOI. If the TOI is not correct, your filing will be rejected at intake, and you'll be expected to refile it by the deadline. So be certain that you get that correctly the first time around. When associating your schedule items in the binder, the standard component ID must be entered exactly as generated by HIOS. Other points are shown here. I'll mention advertisements must be submitted with their own CERF filing and with the filing type advertisement. They can't be submitted with your form rate filing. Remember to set your CERF message settings to accept binder notifications, and changes to your form may require changes to the binder and vice versa. Please note the Notes Reviewer feature through CERF for specific questions regarding the filings. All filing material is a matter of record, including correspondence. So it's important that you correspond with us through that mechanism. If you have any general questions about plan management or general QHP issues, we would ask that you present them to us by email, particularly within 24 hours of the weekly scheduled call. This makes it easier for the form filers to stay focused on your binder and filing reviews, and keeps things more organized here at the department. Please pay particular attention to your HSA plans. The IRS guidelines for HDHP plans must be followed in both the form filings as well as the binder templates. Next, I'll turn it over to Gail to discuss federal fee dates.
Thank you, Ingrid. We're now looking at Appendix 1 on slide 43. The initial application submission and transfer deadline to CMS is June 19th. The initial CMS review is between June 20th and August 2nd. The first correction notices are on August 9th. The final submission and transfer deadline to CMS is on August 21st. CMS review of revised submissions is between August 21st and September 9th. CMS sends final correction notice to issuers with agreements for signature and plan lists for confirmation on September 16th. State deadlines for final plan recommendations from plan management partnership states, September 24th. Issuers send signed agreements, confirmed plan lists, and final plan crosswalks to CMS between September 16th and September 24th. Limited data correction window, outreach to issuers with CMS or state-identified data errors. Issuers submit corrections. CMS reviews and finalizes data for open enrollment between September 19th and 20th. CMS certification notices go out between October 3rd and October 4th, and open enrollment runs from November 1st through December 15th. Next slide, please. The submission deadline for issuers with a state with an effective rate review program to submit proposed rate filing justifications for a single risk pool coverage in the URR module of HIOS is required on July 24th. Target rate on which CMS will post preliminary rate changes is August 1st. The deadline for all rate filing justifications for a single risk pool coverage that includes a QHP to be in a final status in the URR system is due August 21st. The deadline for all rate filing justifications for single risk pool coverage that includes only non-QHPs to be in a final status in the URR system, October 15th. And target date on which CMS will post all final rate changes is November 1st. Next slide, please. The standard and tools that are applicable to SADPs are listed below. Please note with the asterisks allows a modified standard from the QHP standard. The standard or tool does not apply to accreditation, quality reporting, and quality improvement strategy, prescription drugs, cost sharing reductions, patient safety, standardized options, or out-of-pocket cost comparison tool. Please note that the SADP issuers applying for off-exchange certified designations must comply with all standards applicable to on-marketplace plans. Next slide, please. Here you'll see the New Hampshire Insurance Department contacts, the names, titles, and their emails. Should you need to contact us, and these will be, that's it, self-explanatory. Next slide, please. Well, thank you for attending this YouTube presentation. You can see the department's contact information listed below. And please join us on April 18th for the interactive webinar open house from 2 to 3 p.m. You may submit questions in advance to Diana Lavoie. Thank you.